So greetings, everyone. My name is Adrienne Falcon, and I am co-president of the Northfield Cannon Falls League with Pat Johnson. Exactly, that's the two of us who continue to try to shepherd this entity. We are excited to have the program planning meeting tonight. It's been a couple of years since we have had one because of COVID. And so we've been, and just other reasons, we have been doing our program planning through email. So I think we're excited to do this together and proactively do it. As a reminder, program planning is the chance in the year when we can weigh in on priorities for our league to work on, and also what we want the state and the national league to work on. This is a national year, so we're gathering that. At the same time, we thought, let's have a way for everyone to learn a little bit more about the league and how we do our work, and one issue in particular. So often, program planning start with everyone gathering and doing the planning, and then you bring in a speaker. We felt actually that the reverse would make sense to do tonight, because we are very appreciative that Dr. Thoman is willing to join us, and Rebecca is with the Minneapolis League. Mary Carlson will be introducing her, but it gives us a chance to think about what does it mean to move an issue forward through the league process, and then to turn to doing our own Northfield League process. So sort of in that spirit, I want to say thank you for joining us, and I want to turn this over to Mary. We're going to do about an hour with Dr. Thoman, and then we will shift to our business meeting to set our priorities. So we invite you to stay on for that, and also understand if you are here to learn about the topic, and that's also fine. And we welcome you, and we're thankful that you're here, and we hope that you are interested in learning more about both the issue and the league. So with no further ado, Mary, I will let you take it away.
Thank you so much. Adrienne and Pat, you are doing your person's work. So grateful that you stepped up together. You've done an enormous amount of work, even through COVID. So we're really, really grateful for that. This particular topic is something near and dear to my heart. And I've been sort of an off and on advocate for a while for Minnesota to pass a law allowing aid in dying. We have a sort of a informal group in Northfield, about 35 people on my email list of people who care about this topic and get together every once in a while to stay up to date and then to advocate as we can. So I'm really, really happy that Dr. Rebecca Thoman is with us tonight. She has, I'm not sure, Rebecca, I found you as campaign manager and also director of the national group Doctors for Dignity, which is a subgroup of people working with compassion and choices, a long existing nonprofit organization across the country that is aiming to improve end-of-life care in many ways across the board. This is one of their efforts. But she heads up the group that really focuses on inviting physicians to tell their stories, to advocate, to write letters, because they're the people on the front lines, after all. Rebecca herself is a physician trained in family practice and community medicine. She is a fierce advocate, has had lobbying experience, particularly with tobacco and gun control efforts, and then more recently now, these end-of-life options, not only in Minnesota, but I believe Iowa. And you can clarify that if you'd like, Rebecca. She's a member of the Minneapolis League and a friend of mine. And I think we are really fortunate to have Rebecca in Minnesota and then with us tonight. Even though we're not together, it feels like she's one of us since she's a Minnesotan. So I'm really delighted to have you here tonight, Rebecca. Let me just say one quick housekeeping thing. If you are interested to get the slides that Rebecca will be sharing with us, you are welcome to either chat me directly, Mary Carlson, in the chat, or just put your email in the chat and I'll keep track and can get those sent out to you after tonight. We're also recording, so this will be available as well. I think that's it. Rebecca, welcome. You're on. We're happy to
Thanks
have
so
you.
much. Thanks,
Yeah.
Mary and Adrienne. Thank you for having me. Yeah, I was trained in family medicine at the University of Minnesota, and I don't have a clinical practice now. I've actually been doing public policy and healthcare policy for 2 decades. And like Mary mentioned, I've been in a number of areas. I worked for the Cancer Society for about 7 years. And so I've been a lobbyist and doing all that stuff. And actually, I first started lobbying with the League of Women Voters, the state league. So I'm from the Minneapolis League, and I'm going to share my screen here. And I actually don't like a lot of words on my slides, so I don't know if they'll be helpful for you. It's more to help me. So thanks. Tonight, our topic is to talk about concurrence on medical aid in dying, and I will explain that to you as we go. So first thing I'm going to do is start right off the bat with a definition, because I think there's lots of room for confusion about exactly what it is I'm talking about. So medical aid in dying is a medical practice in which a terminally ill adult who has sound mind, so can make their own healthcare decisions, can then ask for from their physician a prescription medication that they can self-administer for a peaceful death if their suffering becomes unbearable. Some of you will automatically think death with dignity. That is the name of the Oregon law. Oregon was the first state to have such a law. And so medical aid in dying is the practice, and death with dignity is the name of that law. And I'll talk more about that. So this came up in Minneapolis back in 2019. The End of Life Option Act, which is the name of the legislation to authorize medical aid in dying, was introduced again by Senator Chris Eaton and Representative Mike Freiberg. They have introduced this legislation in Minnesota here since 2015. And then in 2019, the league decided, our Minneapolis League decided we wanted to do a program on this. And, we thought, do we take a position? And what we learned was that there was a very, very comprehensive study already done by the League of Women Voters of Utah. So that's where we started. We started with the Utah League study, and then we pulled together a little bit more up-to-date information as an addendum, and we went about using this as a program. So like I said, the League of Women Voters of Utah originally passed this, but there have been at least 3 or 4 other state leagues that have concurred. And concur basically means we adopt the same position that they have, using their study as a basis for that. So Maryland, New York, Connecticut, Delaware, and a number of other state leagues have concurred with this report. So we would not be first. A little bit more about the terminology. Like I said, death with dignity is the name of the law in Oregon and California. I'm sorry, in Oregon and Washington. End of Life Options Act is the name of the law in California, Colorado, the name of the bill here. And other laws have other names, like Our Care, Our Choice, or the Medical Aid in Dying for the Terminally Ill. So it gets confusing, but really I like to say what we're really talking about is medical aid in dying. That's sort of the technical word for it. And one of the reasons that death with dignity is used less is because there was sort of an assumption that if you're saying death with dignity, this is death with dignity. And certainly people decide what's dignified for themselves. That is not, we don't have a corner on dignity here. So switching it to the End of Life Option Act. So these are the states. The dark blue are the states where medical aid in dying has been authorized. I'm sorry, not the dark blue, the teal blue. The dark blue are states where legislation has been introduced. And the yellow squares are where there are volunteer groups of people working on this issue. So I wanted to put the list here for you to see in order. So Oregon was the first state, Washington 10 years later, Montana was a court ruling in 2009. Vermont became the first state to pass this in 2013. and then California in 2015. Now, right around there is where the Utah study came out. But since then, a number of states, many more actually, have passed this legislation. Colorado, Washington, D.C., Hawaii, Maine, New Jersey, and just this past year, New Mexico. So about 1 out of 5, 1 out of 4, 1 out of 5 American adults now lives in a state where this is an option. So 22% of the population. And I also want to just say, where does this really fit into, we're talking about end of life, where does this fit into the possible end of life options that are out there? And so pursuing life-sustaining treatment, I think, is sort of the default, do everything. And people can ask for that in their healthcare directive even. So that is also, that's the first option. The second would be refusing life-sustaining treatment. And that would be something you might put in your healthcare directive, or you could discontinue treatment after a trial of it. You can start it, determine it's not, you're done with it, and then you can stop. You can also elect hospice care. Hospice is comfort care only, where the disease is no longer receiving, you're not curative treatment for the disease. So you've kind of exhausted your curative treatments, and now you've moved to comfort only. And hospice is a multi-disciplinary set of services designed to help people feel comfortable, live a better quality of life, support families, and just try to make their last months of life as comfortable as possible. Voluntary stopping eating and drinking is another common end-of-life option. And this, you can think of this as people who may be at the end of life with cancer, and they've sort of lost their appetite. They're really done. They're ready to die, and medical aid in dying may not be an option for them in their state. They can stop eating and drinking, and they will, in 7 to 10 days, die by dehydration. It's often it's mostly comfortable for the patient if they're getting, they need to get hospice medical support to get through that. It's a little bit harder sometimes on the families. Sedation to unconsciousness is also common around the country in every hospital. This is generally for patients who can no longer speak for themselves. They may have an agent working with their medical team, and there's some kind of discomfort. It may be difficulty breathing, it may be pain, and the patient will then receive enough medication to put them into a coma. They'll be titrated to stay in a coma, and then if they stop eating and drinking at that point, they will then again die by dehydration. And then medical aid in dying is I would add this to the list, where a person would proactively decide that they are ready to ingest a medication and go peacefully to sleep. So I'm going to talk now specifically about what's in the legislation proposed in Minnesota, and it basically mirrors the same factors in all the other states. So a person has to be an adult, age 18. They have to be a state resident. They have to be terminally ill with a 6-month prognosis. So think of, that's the criteria for qualifying for hospice. So they would be similar to the hospice eligibility. And then mentally sound, able to make their own healthcare decisions and understand the consequences. So this would not apply to anybody with dementia. If someone has dementia, and I'm thinking Alzheimer's disease, by the time they are 6 months from the end of life, they've lost their decision-making capacity. Now, if someone was in an early stage of dementia where they still could make their decisions and they were dying of something else that was terminal, like cancer, then they would qualify. So I don't want to say the dementia diagnosis excludes someone, but if someone is dying primarily from Alzheimer's disease, they are not going to be able to qualify for this. And then, of course, the last criteria is they must be able to self-administer, and that's primarily by swallowing. The process is also laid out in the legislation. A patient has to submit an oral request, fill out a document, do a written request, and give an oral request to both the original physician who writes the prescription and the consulting physician. The attending physician, and actually in Minnesota, we have included nurse practitioners, which is not the case in every state. but that physician will determine the patient's eligibility, provide them a list of alternatives, give them a referral to hospice if they need it, and just be sure that the patient is doing this volitionally, is not being coerced, and then refer, after doing that whole assessment, then refer to a second physician to confirm the eligibility. So a second physician or nurse practitioner will also go through that process. A mental health referral is only as needed. So what I like to say is it's usually very clear to a physician if a patient has capacity or doesn't. But if they're in the middle there and they're just not completely comfortable determining that, they can ask for a mental health assessment. A few of the safeguards that are built into the legislation that are similar to all the others is that there's absolutely no requirement to participate by any health professional or institution. No individual certainly has to participate, it's completely optional. And then there is also written into the law liability protections. As long as health professionals follow the steps, they're protected from criminal and civil liability. And then in the law itself, it says very explicitly that this shall not be for any purpose considered to be suicide, assisted suicide, etc. So that provides also some built-in protections, for example, for life insurance policies. This is not considered suicide. It's not suicide on your death certificate. It's like other expected deaths in a hospice setting. People die, by perhaps they've stopped eating and drinking, and that's not suicide. So it's not considered that legally. So then the next thing that we did was take the supplemental material. We updated what was already in the League of Women Voters of Utah report and added a few things. So we looked at the data because the states collect data on who uses the law and they do an annual report. And so Utah only had the reports up to 2015. So we added the data up to 2019. We also updated their report on medical association positions because in the last 5 years, there have been some changes there. And then we included the state survey information that we had. So this is just Oregon has the most robust set of data. So I like to do the Oregon data in more detail, but it's important to know that the same trends, the numbers may be different, but the trends are similar in every state that reports, and I'll explain what I mean. So in Oregon, since the law first went into effect, there have been just under 3,000 individuals who've received a prescription and just under 2,000 who ingested the medication. So that's about 66%. And that holds in other states, California, Colorado, Hawaii, New Jersey. All the reports show that about 2 out of 3 patients who get the prescription actually use it. In 2020, 66% of the people had cancer who elected this, 8% had ALS, and 11% had some sort of cardiovascular or lung disease. And again, that echoes across the other states. Cancer is by far the most common reason. And that makes sense because people are often at the end of life and their full mental capacity. The other is neurodegenerative diseases like ALS. So those are the most common ones. 95% of the people who asked for this were enrolled in hospice, which is our goal, get everybody enrolled in hospice, and the vast majority died at home. The vast majority were white and higher education, and we can talk more about that. I think the reason that's important is that I think 25 years ago when the laws were first being developed, there was concern about the possibility of abuse. So safeguards were written in because they didn't want to see poor, elderly, disabled, Black people being offered this inappropriately. And so what we've actually found is now it's sort of the opposite. It's a white upper middle class privilege in a way. It's hard to navigate the process and there's an expense. So just to do a little bit more with the data, in the year 2019, 142 physicians wrote 370 prescriptions that year in Oregon. And that's just to show you that it's not 1 or 2 physicians writing all the prescriptions. It's really been integrated into end-of-life care. There's been no legal action. There's been no evidence of abuse. No physician has been disciplined in Oregon in the 20 years, or in actually 23 years now, or in any other state. So there's no evidence of any sort of misuse. The laws appear to be working as designed. And then if you're really interested, I encourage you to go dig out the most recent Oregon report, and it has a lot more detailed information. I think things like what medication was used, how long was it between ingestion of the medication and the time until they died. There's lots more that you can look at in there, so have at it. A little update since 2016 is that several groups, medical groups, associations have actually withdrawn their former opposition. So historically, groups had, medical groups had been opposed and seen this as assisted suicide. But recent years, they've withdrawn that opposition, moved toward an engaged neutrality position. And what that means is they're not for this and they're not against it, but they're engaged in ensuring that there are safety parameters around it. And then within that, individual physicians, patients, and their families make their own ethical decisions. So it's kind of like the way many medical societies approach abortion. They're not for it and they're not against it, but they want to be sure it's done safely, and individuals make their own decisions. So the American Academy of Family Physicians, the American Academy of Hospice and Palliative Medicine, the American Academy of Neurology, the American Nurses Association, all have withdrawn their opposition. And even the American Medical Association changed its view somewhat. What it did was kind of took another look at its code of ethics and saw that in the code of ethics, it said, this is inappropriate, this is wrong, you can't do it. However, they have a growing membership that is actually engaged in this practice. And so they clarified in the code of ethics that physicians can, following their conscience and doing patient care, they can provide medical aid in dying, and they are not in violation of their ethical obligations or the code of ethics. So are they still against it? It's, kind of maybe, but if they're against it, they're saying it's okay for physicians to do it. So, and that's a big change. Then 12 state medical societies have also withdrawn their opposition, including the Minnesota Medical Association, which changed its position, I think, right around 2016. Then we added some survey data that is specific to Minnesota. There was a statewide survey done in 2016, which showed majority support for the issue in every political group, Republicans, Democrats, Independents, in both the metro and the rural area, and among all religious affiliations as well. In fact, when you pulled out Catholics out of the Christian group, they actually had the highest level of support at 71%. And then people who resided with someone with a disability in their home was at 77% support. And then, of course, there's the Sacred State Fair poll, which lawmakers look to. And in 2016, this question was asked to fair goers. I'll give you a second if you want to read it. So we didn't just say, do you support medical aid in dying? Do you support assisted suicide? We actually laid out what the parameters would be. And with that, 68% supported it. So I'm just going to touch on the pros and cons. I think that the League of Women Voters of Utah report does a nice job of talking about it in a little bit more depth. And this is something we can sure talk about if you have questions or want to discuss it more. The pro side, I think the arguments are this is autonomy and that individual patients should have the right to decide. It's really about relieving suffering. So this is not like suicide where somebody is choosing to die. These people are dying. Whether we do something to provide them this medication relief or not, they're going to die. So it's more about how they're going to die rather than whether they're choosing. They're not choosing to die, they are dying. And so that was seen as kind of a different way of viewing it. And then the fact that there is no evidence of abuse. Any sort of concerns about abuse have been really disproven over. I think if you look at all the states that have done this for all the years and add them up, it's something like 60 years. 25 in Oregon, 12 in Washington, et cetera. So those are on the pro sides. I think on the con side is still the concept that this is morally wrong. And some doctors would say it goes against the Hippocratic Oath. We'll hear the argument that it's unnecessary. Hospice can relieve all suffering without hastening death, and they just don't think this is necessary. And then the concern again is the abuse concern, that this is somehow going to lead to euthanasia, euthanizing people with disabilities, et cetera, or coercing or pressuring people to do this, family members coercing, et cetera. So those are some of the concerns. Then our league just kind of took a step back and said, why would the League of Women Voters care about this? Does this align with kind of what we care about and what we do? They found that it did, that an individual's autonomy over their body, especially has been an issue for women, that aligns with our values. Individual privacy concerns, religious freedom, that much of the opposition is religious constraint rather than one religious viewpoint in dominating, and then equal access to healthcare, to be sure that people, it shouldn't depend on where you live to have access to something like this. That was the thought. And then just to emphasize that this is a state level issue. So this is not going to be something likely that will come down from the US League of Women Voters, because it's not a federal issue. It went to the Supreme Court. It was Sandra Day O'Connor who wrote the opinion that this was really not a constitutional issue and it would be decided in the states. That's why state leagues are in the position to be the ones to decide whether or not to take a position. So this is the actual language of the Utah position with which we concurred. The League of Women Voters believes state law should grant the option for a terminally ill person to request medical assistance from a relevant licensed physician to end one's life. The League believes such legislation should include safeguards against abuse for the dying and/or medical personnel. So kind of what happened, this is sort of the process now that I just wanted to share with you, which is that, so what our league did was, we took the report, we took the addendum, we actually had a civic buzz, which is our monthly meeting. We did a We the People, which is our cable show on this. And then we sent the materials out to the individual units, and the individual units did a program on this. And then we did a vote, so people could vote in their unit or individually. And so the voting came in, we had about 35% voter turnout. Hey, that's not good for the league, is it? But it was 95% support. So we went to concurrence. And so we know we needed to actually take this to the state league because it's a state issue. So in 2020, guess what happened? COVID hit and everything was canceled. So there was no meeting in 2020. So it kind of got pushed to 2021. And we had reached out to the league presidents offering some information on this because we were moving for concurrence. And I think we had a few leagues take us up on that, but not everybody got the information. And so when we brought this up for concurrence last year in 2021, I think it caught people by surprise. A lot hadn't heard about it. So let me see if I have it here. Yeah, okay, that was canceled. And actually we got 58% support, but we needed 60%. So I think it failed by like 7 votes or something. And so I understand that there was a lot of discussion. I think people wanted to know more. And so we've gone about trying to reach out to all the other leagues and do this kind of opportunity between now. And so it will be introduced again at the council meeting in April for concurrence at that meeting. So the delegates who you send will have the opportunity to vote whether or not they support concurrence. And after the last meeting, I should say, after the 2021 meeting, we actually formed a committee, the End of Life Options Committee. We have about 8 or 10 people from 3 or 4 different leagues who got together, and really the goal was to get the word out and do education. And so we've been doing educational forums this year between January and March, even to April. And like I said, concurrence will come up. I think the meeting is April 30th, and I have no idea how delegates are selected, but That's always a mystery to me, but your delegates will be the one to decide. So I'm going to stop here and I want to open it for questions and discussion. I think I'll stop sharing my screen, huh? We don't need to look at that. There. And so whoever wants to take over and do the Q&A, I yield the floor.
I'm a happy Q&A moderator. So, so far I don't see questions in the chat, but I'm happy to have people unmute. We don't have a massive number of folks, so it works if you want to unmute or if you want to put something in the chat. Rebecca is very clear and very succinct, and she covered a lot, and there's a lot you might ask about. So I see Mary Louise Groh showing a hand.
Well, I just could not be more thrilled to see Rebecca talking about this topic, which is very important. It's one I support very, very strongly. And also, I just have to say that we worked together on gun violence prevention when Rebecca was executive director of the state organization that I co-founded, Citizens for a Safer Minnesota, now called Protect Minnesota. And she was wonderful and eloquent then and talked about gun violence perspective from a medical public health standpoint. So I was absolutely thrilled to see that Rebecca was going to be talking to us tonight. So
it's great to see you, Mary Louise.
Anyway, this is really not so much a question as a plug for a wonderful movie. And I've seen it twice, but I wonder, Rebecca, if you've seen To Die in Oregon. I think it's really a very beautiful film, and it follows a woman who's made this choice in Oregon. It came out years ago, but who made the choice and did have medical support for her. She was in late stages of cancer and huge amount of pain. And she planned her last days so intentionally and so lovingly with her family. And the camera followed her right up to the moment where she self-administered the medication given to her by medical support. And I remember vividly, the camera then went to the outside of the house and just saw the light in her windows. Her family was singing to her, but her last words were, "I just wish people could know how beautiful this can be," and how, you know, this, she left on such a good note, and just saying, you know, this is so peaceful. And I think anybody really wanting to follow the story of one person who took advantage of this, I really recommend that documentary. Sorry, oh, I'm getting a call. Sorry, that's my plug, both for Rebecca and the cause and for a movie. I might have to take this. Hi, RT. Hi, dear.
Oh dear, can I mute her? Yes, I can. How about that? Rebecca, Adrian asked whether there is also a written report for the process that the Minneapolis League has gone through with the state. Anything that you sort of summarized in a newsletter or any place?
I think I sent you all the 3 pieces, which are the Utah study, the Minneapolis League addendum, and then the Utah position.
Yeah.
And so those are what we have been using. I think at some point it'll go up on the League of Women Voters Minnesota website. You know, this, you can use this PowerPoint. I'm not sure it adds anything to those 3 documents, but that's what we have. Not so much a summary, but a suite
Great.
of
Yeah,
information.
a suite of documents. Exactly.
If I can just follow up, that is helpful to hear, because at a local level, we have taken on doing a study around policing and sort of responding to mental health crises. And so part of this is educating for us as a local league as to how to do a study. And so when we did that, we looked at California, which has taken a position around policing, but I have not found a report yet. So it tells me we need to go looking. So your process of describing this is helpful. Thank you for that.
You're welcome. And the League of Women Voters Minneapolis did a huge study on policing last year. I don't know if you've had a chance, it's on our website, and we adopted a set of positions in response to that study. So we should talk, because I think that it's the same kind of thing where there are a lot of the solutions are state level solutions, which would have to have a state position.
Mm-hmm.
Agreed. And that was part of our hope with this as well, was recognizing that there was nothing at the state level. Could we start here and then grow? So yes, please. But tonight it's about your topic. So let's turn it back to that.
Other questions
Or comments.
or comments? Yes, Ricky?
I'm not 100% clear on what is involved in doing a concurrence. I don't think it just amounts to saying, yeah, good idea, we agree with you. There's more to it than that, isn't there? What's the concurrence process? Have we talked about that and I didn't catch that?
I can explain it. We went through the concurrence process at the annual meeting. And what happened was our league submitted an intent to have concurrence on this issue, and the board looked at it, and the board decided this was not one of their priorities. So if the board just takes this issue up and says, yes, we support this, it's a priority, you only need a 51% vote to pass. But the board did not take it up. They said, this is not a priority, so it's just going to go through, and you're going to have to get 3/5 vote to pass it. So the first thing you have to do is submit it, and then the board looks at it and decides whether or not it's an issue that they want to prioritize. That's not true at the council. That only happens at convention, which is every other year. I'm learning all these crazy rules. At council, the board doesn't weigh in one way or the other. They just submit things through, and then you need a 3/5 vote. And generally there are a series of meetings, and one of the meetings at the annual meeting was open forum. We actually did a presentation the night before on the topic, but there was open forum where people could get together and talk and ask questions. And then, it just came up. It was the meeting, and they moved the different requests for motions, and our motion was for concurrence, and we had time to discuss it, and then we voted. So it actually does go that quickly, which I think is part of what our challenge was, because not very many people had quite as much preparation last time. So even though we had presentations and stuff, it's just, it was hard with COVID and everything else. So yeah, it will be the same process. In fact, I think council's just one day. So there will be a section on that agenda where they take up the resolutions, and we'll discuss it, and then we'll vote.
Thank you.
So I should be clear, and then I'll get to Mary Lewis's question. Just as a follow-up there, say our Northfield Cannon Falls League now has conversation about aid in dying. Is our discussion aiming toward our local league concurring and then proposing at council?
You don't have to concur, you can concur just to document that, so that you have a position. You can say, okay, delegates, we concur with this, go forth and vote for it.
Okay.
But you don't have to do anything at the state level other than be prepared to, you can comment on it when it comes up and vote for it.
Got it. Okay, Mary Lewis has one, and then Joan, I think. So let me just ask Mary Lewis's, which is, what are the odds of it passing at the legislature this year, Rebecca?
Oh, it will not pass this year. It's really at the very early stages, because it's only had a few hearings. Since 2015, it's had 3 bill hearings, twice in the Senate in the Health Committee, and once in the House in the Health Committee, and there's never been a vote taken. So the challenge is that there's not a lot of noise about this. It gets drowned out in other causes. And, frankly, working with the people who are the strongest advocates, they're terminally ill, or, they're families of people who are terminally ill. So I think we've been trying to do kind of what the whole medical marijuana strategy was, which is to bring people's stories to their local lawmakers. So we've got to have individual people talking to their lawmakers. And once we get a critical mass, enough people are doing that, it will become a higher priority. Right now, it's not, because we don't have the clamor coming from the grassroots. And also, even though it's a nonpartisan issue, people, the vast majority, as you saw, of Minnesotans on both sides support it. It becomes politicized at the elected level. And so that becomes a problem. It becomes controversial there, even though it's not among people. And interest groups, get the primary interest group being the Catholic Church or the Right to Life groups. Those are the primary opponents. And so, it makes it tough. But really, it's going to be all about individuals. And if this were to pass, I don't think that the League of Women Voters, is going to make this a top priority for their lobbying team. But the individual member lobbyists can go and lobby. I'm sure that the volunteer lobbyists can say, we want to talk, we want to do this. And so they'll be able to, but they don't have to. I just, at some point, hopefully we'll elevate to a higher level and the league will be ready, but not this year. And, it's always a question of every 2 years we have a new election, as you all know. So we can probably know on December 8th whether or not we have a chance next year.
Yeah. Okay, thank you. Joan?
Well, I just wanted to talk about the procedural issues. And it would be true for us that the Northfield League could study this issue as a local league, and we could adopt that position, but it could only be something that we could use here in Northfield. Like we could lobby our hospital people to see what kind of position they might take, or inform them or educate them. But we couldn't go beyond our own community. But we could study it here, and we could have a local league position, and it would probably be the same position that the state would adopt later. And so that's one way of getting it. We would adopt the Utah, is that the state that did it?
Yeah.
Yeah, we would adopt their position tailored to our need, but we could concur with Utah's position, and then we could use it on the local level. And I assume Minneapolis has or could do the same thing.
Well, we have actually we've been told that we cannot lobby on something that is a state issue unless the state league has a position. We can educate.
That's what I said. We could only lobby in our community for our own hospital here or our own medical people. We couldn't go to the state. We couldn't ask our legislators to do a statewide position until the league had a statewide position. But Minneapolis could talk to its medical community, or it could talk to city council or something like that, and see if they could get something for Minneapolis, or maybe the Hennepin County leagues. So that's the way. And then when you get a groundswell, then you can do the state. And that's where we started with Mary Lewis's gun control thing too. many thousands of years ago. And that's when we first came up with this idea of doing a concurrence.
Yeah, Joan is my hero, because no, really, I mean, I every group I talk to, I talk about the mentoring I got from you, and none of what followed would have happened without you.
No, Mary Lou's had a great idea, which I was happy to help with. So anyway, it was a team effort, but that's what the league works. It is a team effort. And now we have the opportunity to do something here in our community.
Go ahead, Mary Louise.
Rebecca, how many leagues have you talked to already, and how many will you be talking to?
Oh my gosh. I think you all are the third or fourth, and there are 5 more. So we're hitting most of them, and we're hitting the big ones, and some of them are piggybacking, because Like I did, we spoke with Rochester last week, and some of the Red Wing people came to that. So I'm hoping we hit most of them. Our committee has been reaching out to the presidents of every league. So we want to be sure every league has the opportunity.
Great.
Bonnie Jean, you're next. And looking around, I know there's a lot of people on this call who know a fair amount about this issue already. So I hope if others of you have questions that you're a little embarrassed to ask, you're not embarrassed. Go ahead and ask. But Bonnie Jean, hi, you go.
Hi, I just wanted to mention that a couple years ago, I was trying to find something to watch online, like we've done that a little bit in the last couple of years. And I found a movie, Susan Sarandon is in it, and it's entitled Blackbird. She plays the role of a woman who has made this decision, and she's called her family together. Her husband is played by Sam Neill. So it isn't a documentary, it's a screenplay. But I found it very engaging, and I would recommend seeing it. Difficult to watch in many ways, but important. Just wanted to mention that. So the title again is Blackbird.
Yeah, there are actually more and more really good movies coming out. And if you are a member of PBS, you can stream for free the movie Diane Reeves' When My Time Comes. That just came out last year. We've been trying to get Channel 2 to play it, and I'm hoping they will this year. But she really takes, it's sort of a look at the pros and cons, and talks to physicians and talks to patients and does a lot of sort of journalistic approach to it. And it's less than an hour. So if you have, if you're a TPT passport, you can view it there for free. She also has a book by that title. That's right.
And it looks like it might be on YouTube at this point. I just found it. So we are putting, as we're sharing these movies, we're putting the links in the chat for anyone who wants to find them.
I'm pretty sure you can get it on Amazon Prime too. You can rent it for $3 or something.
It's like my classroom. I'm fine with silence because people are thinking. We have a few more minutes.
And I never feel the need to take up time. It's like when we're done, we're done.
When we're done,
Less
we're
is
done.
more.
I can't see everybody. It is sort of funny because in a classroom, I do look around and see. Oh, you're looking like you wonder.
Kimberly's group looks comfortable.
Yeah.
So what are we being asked to do here? Just basically, I mean, you know, the presentation was wonderful. I agree with it. But as a group of people, what actually are we asked to do here?
Well, I think the League of Women Voters of Minneapolis would ask that the League of Women Voters of Northfield Cannon Falls concur with the Utah position and instruct your delegates to vote in favor of statewide concurrence at the annual meeting in April.
Okay, so that's the action you would like this group to take, correct? Okay,
Yes.
do we need some sort of a concurrence? I mean, if we choose to move forward with this, you know, what are the next steps for this?
Yeah, I would leave that up to your board. We went through a process. We're a pretty big league, so I think it kind of depends on how big your league is and how you you know, how you make decisions. So whatever your process is for deciding, making decisions, I don't know what that is. Maybe Adrienne, do you have a comment?
I can try. What I would say is I completely agree with you, Rebecca, that it is about our board sort of taking this up and then at a board meeting agreeing that this is something that we can take up. And then presumably we would send out the Utah position to all of our board members and then either host a session where we discuss it or electronically ask our members to respond and then vote at a board meeting about it to see if we have that concurrence. But I am not necessarily the procedural. Mary and or Joan might have ideas from, or any of the other former presidents. We have a number of them on the call. So that's what I would suggest, but I'm also more than happy to defer to others with more knowledge of our board, local board.
Jane?
Jane, you're muted.
Before she unmutes, there's one of the real experts.
Well, I think that your idea is really a good one, Adrienne, because I think that even though I would guess that most people would really support this, I think that it would be really just from a unity standpoint to have an opportunity to have maybe an all city meeting to discuss it and make sure that everybody had an opportunity to talk about it. It was interesting to find out that 67% of the people involved voted yes, Rebecca, when you gave that statistic. And so in other words, it means that people probably would support it, but it's also a really controversial issue. And if the board made that decision on their own, I think that might be not looked upon positively by some of the members.
Well, I'm glad you spoke up, Joan, because I've always thought of the league as being a grassroots organization. And then back in the day, you know, we used to take 2 years to study something. So I think we owe it, the board owes it to the membership to have something. I'm sorry that more people aren't here because members should have benefited from your wonderful presentation to get, you know, the big picture of the issue itself and then the history of the league's work nationally and states positions nationally. So I guess as a member, I'd like to urge the board to think about what you believe our responsibility as members should be in order to give you guidance about whether to take a position on this, a concurrence. I have no idea how many members we have. If this is all there is for membership, then, you know, maybe this group could have a discussion and give guidance to the board. I was very privileged. I took an elder collegium class with Ed Langerak, and the topic of the class was tough conversations or something like that. And we looked into this issue quite in depth, and he had a lot of information. So he might be somebody we could recruit to do some kind of a presentation for our membership in order to help supplement or, you know, replace what they would miss not having been here tonight.
Also, you have this recorded, right? So you could share the recording.
Mhm. Well, and we're meeting after this to have program planning, right? So it'll be part of the discussion. I see one last sort of pragmatic question for you, Rebecca, and then I think we'd probably be ready to move to the next part of our meeting.
Okay.
I'll look around. People can yell at me if that's not true. Our younger member, Thea, asks about whether you have a year in mind of when you'd like to see this passed in the state of Minnesota.
A year in mind?
A year in mind.
Next year.
Besides 5 years ago? Yeah, next year. After the election of 2022.
It's going to depend on who we elect.
Mm-hmm.
So realistically, 3 years would be good. But again, it depends on who we elect.
has anybody developed resolutions for their political parties, for the caucuses? Is there a way that as members of political parties, we should get engaged with this?
Yeah, we have, we put out information about resolutions. Mary, it sounds like you have one, huh?
I did do one.
Good.
Yeah, I think today was the last day.
Oh,
Maybe
What?
you can do it tomorrow. The caucuses are tomorrow, so
9 o'clock tomorrow night.
but
Oh, I got something from Carl's list, and I filled it out. I was going to be a virtual attendee of the meeting, and it turns out that it was too late. It had to be in last Saturday.
for the
really,
virtual attending, yeah, I think you're right.
oh,
I'm a little confused about, excuse me, virtual attending? For virtual attending for what?
For the district meeting.
Well, the DFL isn't having, they're not having, you just send in forms.
Now, the Rice County DFL is not having even
And I
Zoom.
remind-
Zoom.
That we are a nonpartisan group, so I'm torn now between wanting to share information and not adopting only one stance. Kathleen, I see that you have your hand raised.
Hi, thanks. So the Republican Party is holding its caucus at 7 o'clock tomorrow at Northfield High School. The DFL is having a contactless caucus. If you send in a non-attendee form by email, to indicate you want to be a delegate, and if you email your resolutions to, if you live in Rice County, it would be ricecounty.dfl@outlook.com. You could also email resolutions. The other thing that you could do, depending on where your group would normally caucus, would be to drop resolutions by, say, the middle school, if that's where your ward and precinct has generally met before. So it's not too late to sign up. If you want me to send you a non-attendee form, I'm happy to do that. I'd be happy to do, for Republicans, it would be just attending in person, Northfield High School, 7 o'clock.
Thank you, Kathleen.
Yep.
I think we probably need to let Rebecca go. I'm kind of looking around. I know how to find her. We know how to find her.
Thank you
If
so
we have
much for taking the time
follow-up,
to talk
yeah.
about this, and feel free to reach out to me and at any time.
So glad to have you. Thank you
Thanks.
for your materials
Thank you. It
too.
was
Stay
great.
warm, everybody.
So
Thank
much.
you.